Okay, pancreas is an organ located in the abdomen behind the stomach. The animal behind the stomach. It plays an essential role in converting the food we eat into fuel for the body's cell. The pancreas has two functions. Only بزانن. لبريدواي green gap زانين pancreatic cancer. ببي function كان طيب كان يتلاقي.
If you can please keep it in English.
Okay.
Better.
So we have two main functions, the exocrine function and the endocrine function. The exocrine function of the pancreas help in digesting food, okay? The endocrine function regulates the blood sugar, okay? By hormones. Okay, now the location of the pancreas and this part. We say the pancreas is located behind the stomach, okay? In the abdomen, in upper part of the abdomen. It has four parts, head, which lies in the right side of the abdomen, behind where the stomach meets the duodenum, okay? This is head, this is neck, and this is the body behind the stomach, and this is tail near the spleen. Okay, 50% of the pancreas is composed of head. Okay, most part of the pancreas is composed of the head, and 50% neck, body, tail. Okay, there's several major blood vessels surrounding the pancreas. This is important to know about the blood vessels surrounding the pancreas in order to understand the ultrasound, how this appears on ultrasound. This is superior mesenteric vein, okay? This is the superior mesenteric artery. This is portal vein. Portal vein is very important. And this is celiac axis, okay? And this is pancreas, head, neck, body, tail, okay? Then arteries, vein, portal vein, and this is celiac axis.
Where is the celiac axis?
This way.
Okay.
Okay. This is the pancreas, and also the duct system of the pancreas is very important to understand about the ducts, because most of the time when there is a cancer, when there is a tumor, it will block the duct, and when there's a blockage, it will be sign and symptoms of the this tumor that connect blockage the ducts. It will produce sign symptoms by this tumor. There's cell here. On the pancreas called acinia. These cells, it will produce composite of the cell, produce glands. These glands will secrete enzymes that help in digesting food. This enzyme it will secrete in the pancreatic duct, and the pancreatic duct connecting here to the common bile duct. The bile duct and the pancreatic duct, they produce the pancreatico duodenal duct here, call it pancreatico duodenal duct, which is secrete these ducts into the duodenum. Pancreatic cancer. Here is pancreatic cancer. Pancreatic cancer can be divided into two types. We have two types of the pancreatic cancer, the exocrine and call it non-endocrine pancreatic cancer, and neuroendocrine pancreatic cancer. We have two types, exocrine and neuroendocrine pancreatic cancer. Keep in mind that exocrine pancreatic cancer is most common type. Yeah, it's about 95% of the pancreatic cancer is exocrine. 93% of the pancreatic cancer are exocrine tumor. They start in the exocrine cells of the pancreas. We say that exocrine function of the pancreas is producing enzyme that help in digestion. So this tumor arises from the exocrine cells. The exocrine pancreatic cancer are classified according to this. There are types, adenocarcinoma. So when we are talking about pancreatic cancer, it means we are talking about adenocarcinoma, because 95% of the pancreatic cancer is adenocarcinoma. So most of the tumor that arising in the pancreas is what? Adenocarcinoma. The other types is about 1%, 2%. We have also squamous cell carcinoma, adenosquamous carcinoma, colloid carcinoma, acinar cell carcinoma, intraductal papillary mucinous neoplasm, and mucinous cystic neoplasm with an invasive adenocarcinoma.
So, Victoria, first, what's the difference between exocrine and endocrine? If the gland secretes into the bloodstream, it's endocrine. If it secretes outside the bloodstream, it has a duct, it's exocrine. Okay? For example, the liver secretes the bile through the common bile duct to the duodenum. So this is exocrine component. And it secretes a lot of coagulation factors and enzymes, I don't know what, into the bloodstream. So this is endocrine component.
Yes.
So now the pancreas. Pancreas secretes pancreatic enzymes into the duodenum,
Yes.
into the pancreatic.
Yes.
This is the exocrine component, which is the majority of the tumors.
Yes.
The endocrine component is which part? Is the part that secretes hormones into the bloodstream.
Yes.
Like what hormones?
By cells called the isolate of Langerhans.
Islets of Langerhans, which secrete insulin and glucagon and vasointestinal peptides and so these cells, if they have a tumor, there will be an endocrine tumor of the pancreas. But the vast majority is exocrine. Okay? Good job. Continue. I'm sorry for the interruption.
Okay. Now we came to the pancreatic neuroendocrine tumors. This is about 7% of the pancreatic tumors are neuroendocrine tumors. They are classified by hormones they make. For example, gastrinoma arises from the gastrin, glucagon arises from the glucagon. Also,
From the gastrin secreting cells.
Yes.
Glucagon secreting cells.
Yes.
Insulin secreting cells and so on.
Yes. Insulinoma, somatostatinoma, lipoma, and non-functional islet cell tumors. Islet, yes. Now we came to the symptoms. If someone has the tumor, how it appear? The pancreatic cancer often doesn't cause symptoms until the disease is advancing. When they happen, signs and symptoms of the pancreatic cancer may include belly pain, abdominal pain, loss of appetite, weight loss, yellowing of the skin, jaundice, light colored or floating stool, dark colored urine, itching, new diagnosis of the diabetic, pain and swelling in an arm or leg, which might be caused by a blood clot. Risk factors. Here we come to the risk factor. Smoking is first, type 2 diabetes, and chronic inflammation of the pancreas. Pancreatitis is one of the causes of the pancreatic tumor, and also family history. Obesity is one of the risk factors, and old age. Most of the pancreatic cancer is above 14. So old age is one of the risk factors, and drinking a lot of alcohol is also one of the risk factors. So how we diagnose the pancreatic cancer by imaging test, it plays an important role. First, ultrasound, CT scan, MRI, PET scan. Also, we have endoscopic ultrasound. And also, we have, when we diagnose a tumor, we can take a biopsy for staging also. And we have blood tests, carcinoma 19.
You take a biopsy for diagnosis, not for staging. Staging is by chest abdominal CT.
Yes.
You don't do staging by biopsy.
Okay.
Biopsy is for histopathology.
Yes,
diagnosis.
for diagnosis, yes. And also we have blood tests, which it will be high when there is a pancreatic cancer, carcinoma 19. Okay. Treatment of the pancreatic cancer, it depends on the stage and the location. Those are the treatment surgery. You have many surgeries according to the stage and according to the size, according to the location of the tumor, if the head, even the head, even the tail, even the body, according to the location of the tumor. And we have radiation therapy, chemotherapy, and palliative care for the stage 4 tumors that doesn't. Okay, now we came to the normal pancreas on ultrasound. How it's normally appear on the ultrasound. This is pancreas, okay? This is pancreas. This is head. This is body, and this is head. This is superior. This is corneal vein. It's splenic vein. Okay, sorry. This is splenic vein. This is superior mesenteric artery. This is aorta. This is inferior vena cava, and this is common bowel duct. Okay, and this is pancreas. Okay, this is splenic vein. This is superior mesenteric artery. This is aorta, and this is inferior vena cava. Also, this is pancreas and splenic vein. So this is pancreas.
So it can be hypoechoic, isoechoic, hyperechoic,
Yes.
very hyperechoic.
Yes.
It's all normal.
Yes.
According to the age and the obesity and the dehydration and whatever.
Okay, and this is the CT of the pancreas. This is normal. How it's appear on the CT normal. This is head, body, and this is tail. Okay, and also this is a common bowel duct.
I don't know. Fine.
Okay,
Maybe.
and this is according to the. This is pancreas. And so this is pancreas.
No. This is here. What's this?
Inferior vena cava.
IVC, exactly.
Yes, and this is aorta.
Okay, and this is the uncinate process of the pancreas.
Yes. Okay, this is adenocarcinoma of the head of the pancreas. Usually, the adenocarcinoma of the head of the pancreas, it will appear as hypoechoic mass. Hypoechoic. This is hypoechoic mass.
Big mass, ugly looking, hypoechoic, and what do we see here?
Dilation.
Ductal dilation.
Obstruction of the duct, yes.
Obstructing the duct.
Yeah.
And you can see this duct is markedly dilated.
Yes.
Good.
Okay, and this is adenocarcinoma on the CT scan. There we can see the tumor on the head. Also, there is the tumor. Also, there's obstructing and dilating the ductus here.
Okay. And what about this thing here?
Also, there's the dilatation of
Dilated
the
pancreatic duct, markedly
dilatation of the
dilated.
pancreatic duct. Yes, here. Okay, this is infraductal papillary mucinous neoplasm. We can see this small sized. This is ultrasound. This one, this one, this one.
Basically, it's a cyst in the duct.
Yes.
Something like that. Okay?
And this is the CT of infraductal papillary mucinous neoplasm. This one, this one.
I mean, the name explains everything. It's in the duct.
Yes.
It's mucinous.
Yes.
It's a tumor.
Yes.
So, tumor in the duct with mucinous content looks like a cyst or something like that. But what the name is self-explanatory.
Okay. Mucinous cystic neoplasm of the pancreas. Cystic, it means cyst, contain fluid. This is cystic. We can see the cystic. This is ultrasound. And this is the CT scan. We can see the cyst. Histopathology. And we have acinar cell carcinoma of the pancreas. This one.
So this means adenocarcinoma or neuroendocrine?
Yes, it's okay.
That's okay.
Yes.
That's enough.
Yes.
It's adenocarcinoma. And here what's this?
This is how they appear on ultrasound.
What this line is?
Needles?
The biopsy, yes, biopsy.
Yes.
They are doing a biopsy for it.
And this is neuroendocrine pancreatic cancer. It's insulinoma. It is most of the time it's less than 2 millimeter. Insulinoma is very small. We can see on the CT scan. We can see on the ultrasound. It's very small pancreatic tumor. And this is gastrinoma. I think this picture wrong. Yes.
No.
This is gastrinoma. Okay. This one. This one is gastrinoma. Okay, this is glucagonoma. This one.
That's a diffuse one, large one.
Yes.
And what is this?
Metastasis.
Most likely metastasis.
Yes.
I mean, still one with metastasis, as usual.
And this is lipoma.
What do you think the clinical presentation of a patient with lipoma?
Lipoma. Diabetes. Speaking area.
لا هو يعني وصلت له شويه lipoma اختصار vasospinal peptide.
Yes.
So patients with lipoma presents with diarrhea. Okay? Diarrhea, a lot severe diarrhea. Okay? And this is a biopsy needle, okay?
Yes.
So what do you think this ultrasound is from where? From the abdomen, from the
Endoscopic
back?
ultrasound.
This
Endoscopic.
is endoscopic
Yes.
ultrasound. نفس الصورة مال transvaginal ultrasound. It's the same thing. Thank you very much. Well, first of all, just let me comments on what the scientific content, let's say. So the difference between adenocarcinoma, the exocrine, and the rest of the neuroendocrine here, insulinoma, glucagonoma, lipoma, وكل هالصواري. Adenocarcinoma is asymptomatic, like you said. Usually, when it produces symptoms, it's too late. It's too late. Okay? And the main symptom that it produces is painless jaundice. Not only jaundice. Painless jaundice. He's perfectly well. He has no pain. He's jaundice. Okay? Painless jaundice, it's pancreatic adenocarcinoma until proven otherwise. Okay? While the neuroendocrine tumors, in the vast majority, they are small. Why they are small? Why we discover them when they are small? Because they produce symptoms. Okay? So, in مثلا insulinoma, they produce hypoglycemia. In lipoma produce the patient will go look for treatment early. So, we catch them when they are small, like few millimeters or all of them, ما عدا which non-functioning islet cell tumor. The last one, it's not functioning. So the patient will have no symptoms. هو بالاسم non-functioning. بقية كلها functioning. The problem is they produce symptoms. Most of the time severe symptoms, يعني severe hypoglycemia, severe diarrhea, severe I don't know, but they are too small, too difficult to diagnose. Like you have to look for a 2 millimeter or 3 millimeter. It's very difficult, and sometimes in patients with severe symptoms, they have to go and do intraoperative ultrasound. The surgeon opens the abdomen for you, and you come and you put the probe on the pancreas directly, trying to look everything, trying to look for a 2 millimeter or 3 millimeter. And sometimes when even intraoperative ultrasound is not diagnostic, they go blindly and do a pancreatectomy. They remove half of it, and let's hope this is the half that contains the tumor. In some cases, even intraoperative is not working. They just go blindly. Let's remove half the pancreas and let's hope.
Especially the head.
Especially?
The head, because
No, usually they remove the tip.
Yeah.
Because it's easier surgery.
No, because most of the cancers are in head.
I'm talking about islet cell tumor, not
Okay.
adenocarcinoma. Adenocarcinoma in the head, they do what surgery? Weapon surgery. And they remove them. Okay. That's the first thing. So even the early ones are difficult to diagnose. Okay. Can you name someone famous who died with pancreatic adenocarcinoma?
Steve Jobs.
Just say it. People are helping you. Take the help. ستيف جوبز بفلوسه بشهرته بإمكانياته he because pancreatic adenocarcinoma presents late guys because they present late the 1 year survival rate in the best center in the world is not more than 2%. 1 year. So pancreatic adenocarcinoma, usually within 6 months to 1 year, he will pass away. Unfortunately, no matter what you do, it's late. And the vast majority are inoperable because the area there contains like the aorta and the SMA and the celiac and the portal, all vital structures. You can't cut them. It's inoperable. Okay?